Alright guys, this is going to be the last video for this chapter, and I'm just going to be talking about a few diseases that are associated with either depressed or overactive immune responses. Um, the first are the inherited immunodeficiencies. And this list is obviously incredibly vast, and there's no way that you would ever cover them in one course. Um, but of course, these are inherited, so they're passed down through genetics from the mother and the father, and some can be relatively benign, like those that affect the complement system, which is basically your innate immune system's way of enhancing immune response. But some can be extremely severe and deadly, like severe combined immunodeficiency disease, or SCID, SCID. SCID is a complex disease, and basically what it does is it basically causes your T and B cells to be basically non-functional, and it basically results in your body not being able to fight off even mild infections. Before I get more into that, um, of course, not to get too much into genetics, because this is not a intro to biology course, but um, you may be familiar with, or you might be interested to know, that you can sometimes be carriers of disease and not present the symptoms in your own body. But if two carriers of a disease produce an offspring, they have a chance to produce an offspring that may have the disease. And so there's a lot of things with genetics that I think are interesting to think about when it comes to inherited immunodeficiencies. Um, the classic example of SCID is this boy in a bubble. His name was David Vetter, and he had SCID, and unfortunately, we did not have any treatments available for this boy at the time, and he lived his entire life, 12 years, even going out in public in plastic bubbles. It's a very, very sad thing. He did, unfortunately, at the age of 12, die from just what would be a mild infection for any other healthy individual. But some good news to this story is that there are some new treatments that are given to patients that do so. You can treat this one of two ways. The classic way to now treat this is through radiation therapy, which destroys bone marrow, and then receiving a bone marrow transplant. But now, using David Vetter's own immune cells, they've come up with an alternate form of treatment for this disease that has actually been showing promise. And there's been 9 of 14 individuals that have received this treatment that are now living natural and healthy lives. And so it's an unfortunate story, but interesting nonetheless. The next I'd like to talk about, in terms of a disease that can cause suppression of the immune system, the big one is HIV, which then turns to AIDS. Although there's obviously many viruses that cause suppression of the immune system, only one of them can wipe it out completely, which is HIV. HIV is a virus that maybe you're familiar with, but it's transmitted through semen or vaginal fluids and blood, and that either is transferred from individual to individual through risky sexual activity, or by the sharing of needles through intravenous drug users, or tattoos and anything where you would be piercing your skin with needles. Um, there are sometimes, but not always, flu-like symptoms in the first 1 to 2 weeks after infection, and that is because of seroconversion, which is the development of antibodies. Um, but so, unlike normal viruses, once you've created the antibodies, you become immune, or you're protected from that uh, virus. That is not the case with HIV. What happens after that is your body's immune cells are basically destroyed over a period of a few years. And eventually, you get what is called AIDS, or acquired immunodeficiency syndrome, where basically your ability to fight off any infections is completely gone. It's the late stage of HIV infection, and it occurs when your immune system is badly damaged. In the US, which is obviously a very well developed country, most people with HIV that don't develop AIDS, because that we have developed HIV medicine that is prescribed to take every day, which stops the progression of the disease. Think about somebody like Magic Johnson, for example. Um, but those that do get AIDS typically only survive on average for 3 years. Once again, because they're unable to fight off infections that normal, non-immunocompromised individuals would be able to. Um, just here's a person I'd like to talk about. It's Dr. Anthony Fauci, and you're probably very familiar with him in the news right now, as he's the leading individual talking about the coronavirus, of course, without, I guess, some trouble in his way as well. But most notably, Dr. Fauci was a huge individual in the AIDS epidemic that was in the 80s and 90s. He did a number of things, including dramatically loosening the HIV drug clinical trial requirements, and that allowed a far greater number of these desperate patients to try these new compounds. That's called parallel tracking. And he expanded research on HIV and AIDS and its treatment in underrepresented women and or people of color. And he gave activists and people living with HIV seats at the table of the planning committee of the AIDS clinical trials group. So he's done a number of really, really important things. Obviously, they call him America's most trusted doctor for a reason. In fact, if you remember the Ebola pandemic that was very recent, a few years ago, that was a scare that we had. He was 75 years old at that point and going in full hazmat suits to study this Ebola. So obviously a really, really important figure in the American healthcare system and somebody who deserves recognition, including for what he's doing today. Um, the next thing I want to talk about are hypersensitivities. And when you use the word hypersensitivity, that simply just means you're sensitive beyond normal levels of activation. So, so some of us might think we are hypersensitive to allergens because our allergies are acting up, but that's not quite what hypersensitivities are. Although some of us could be extremely hypersensitivity by getting asthma and things like that, but a normal runny nose is regular sensitivity. Um, Antigens are causers of allergic responses. They're often called allergens, like pollen and animal dander and dust and things like that. The specificity of the immediate hypersensitivity response is predicated on the binding of an allergen-specific immunoglobulin E, or you'll hear it called or wrote IgE, to the mast cell surface. This is hypersensitivity 1. Most allergens in themselves are non-pathogenic and therefore are innocuous, but you'll still develop mild allergies, which again you can usually treat with antihistamines, right? Antihistamines meaning counteracting histamine. And that will basically take your allergies away within a few minutes, right? We're all familiar with that. But so others could develop severe allergies from very innocuous things, peanuts or shellfish, that could, or bee stings, and those could cause things like anaphylactic shock, which could be fatal within 20 to 30 minutes if untreated. And so it's important to understand what you're allergic to so that you can avoid certain situations. And if you have a known severe allergy, you're always encouraged to keep automatic epinephrine injectors, basically an EpiPen, with you at all times, especially when you're not close to a hospital with 20 to 30 minutes of travel time. So very important to think about. The type 2 and the type 3 hypersensitivities, basically all that's different here. Type 2, instead of immunoglobulin E, it's immunoglobulin G, mediated lysis of cells by the complement proteins, and it occurs during mismatched blood transfusions and blood compatibility diseases such as erythroblastosis fetalis, which is basically when you read the section on transplants, basically if you're getting wrong amounts of blood, this is the type 2 hypersensitivity, which basically the blood will start to coagulate, obviously very painful and very deadly. And then type 3 hypersensitivity occurs with diseases that are systemic, like lupus, erythematosus, where you get soluble antigens, which is like DNA and other material from the nucleus and antibodies that accumulate in the blood and not get broken down, and it'll be to the point that the antigen and antibody precipitate along blood vessel linings, which causes inflammation in those blood vessels. which is not good. Um, and the last one is the delayed type 4 hypersensitivity. Um, so we're pretty familiar with delayed or type 4 hypersensitivity. It's basically a standard cellular immune response. In delayed hypersensitivity, the first exposure to an antigen is called sensitization, right? It gets sensitized to a certain antigen. And on re-exposure, a secondary cellular response will result, like secreting cytokines that'll recruit macrophages and other phagocytes. It's basically the regular response of a cell. The sensitized T cells of this class will also activate cytotoxic T cells, and the time it takes for this reaction to occur accounts for a 24 to 72 hour delay in development. Things like this are poison ivy, right? If you touch poison ivy, you won't really know unless you're looking at it, but you won't know for a day or two or three until you get the rash that presents. Such as the same as sometimes people are allergic to touching metal nickel. And that's just because there's a delayed hypersensitivity because it takes time to activate those cytotoxic T cells and get this reaction to occur. The next are the autoimmune responses, which are some of the worst cases, the immune system overreacting, because somehow, we're not always sure, tolerance breaks down and the immune system in individuals will begin to attack their own bodies, which causes significant damage. The trigger for these diseases, like I said, is usually unknown, and the treatments are usually based on resolving symptoms. So you'll have to use things like immunosuppressives and anti-inflammatory drugs such as steroids. Now, that word, immunosuppressive, is unfortunate to have to take because, of course, if your immune system is suppressed, you are not going to be able to fight off things like, well, for instance, viruses. So that's one of the reasons why this current virus, it's so important for us to slow the spread by doing what we can, of course, because these immunocompromised individuals are going to be unable to fight it off and will have severe rates of death. And so with that, I'm going to call it here. Again, not going to make a video on this next section. It's a very small section about transplants and things like that. I'd like for you to read it and just be aware of it. But it's pretty straightforward. We've already talked about what happens when blood types and Rh factors aren't matched up. So anyway, with that, I will see you in the next chapter.